Hello, in this analysis we're sharing some new ideas in understanding burden of cystic fibrosis. We had pulled the national database for hospitalizations from 2016 to 2020, which gave us approximately 175 million hospital records, of which we took the ones which had cystic fibrosis and the ones which were only in the mid-Atlantic region, which were approximately close to 14,000 hospitalizations during those 5 years. And then looking at these 14,000 hospitalizations, we created 8 cohorts, which looked at the cohort 1 was all patients. Then we had the patients which had the 90 percentile of charges, and then or the less than 90 percentile charges. Then top 90 percentile by comorbid score or less than 90 percentile, and then those who died in the hospital and the ones with and without COPD. 2 trends stand out here. One is the quite high rate of hospital length of stay overall, and then second, we see in the top 90 percentile by charges, and then the ones who died in the hospital, we see quite high hospital length of stay in the range of 28 to 30. And then we looked at the records to analyze which ones were associated with ED visit, and then we saw that the patients who had a very high comorbid score, in those patients, approximately 70% of them came via the emergency department. And interestingly, also for the patients who had COPD, we saw a vast majority came via the emergency department. And then using a previously published list of severe infections, we also looked at what percentage of these patients had infections while they were in the hospital. And then we see overall we see all of them had quite high rate of infections, more than 40%. And then we see in the category of patients which had more charges, and the ones who died, it was approximately 64% and 84% respectively. And then we looked at the top principal ICD-10 codes. So the ones which jump out are one is sepsis, then pneumonia, lung transplant infection, pancreatic insufficiency, and then we also saw a code for a whole range of codes for complications of other transplanted organs. And this leads to a number of questions. The first one is what is leading to high hospital length of stay in some CF patients? How can we prevent pneumonia, which seems to be one of the most common infections in CF patients? And how can we better manage transplant-related complications? And also, of course, how can we improve the overall health outcomes in these patients? So we hope some of this analysis was useful. Please feel free to contact us if you might need some more information on this analysis. This was only a very small part of many trends that we saw in our analysis. Thank you.